Today I'm going to talk about healthcare and living in your vehicle. So I think it was sometime in October, I finally received proper healthcare. I think it was the end of October maybe, and by the time I got everything scheduled and kicked in, I couldn't really make any appointments until basically now. And so now I'm working through my healthcare. I'm pretty healthy in general, but you may have noticed that there's already been a change, and it's been a pretty big one that I just did today. And of course, I'm talking about the only real health issue that I have, and really have ever had, at least since I was a little kid. So I am super nearsighted. My vision is really terrible without glasses, but it can be corrected, and I haven't been to the eye doctor in probably 8 years now. So part of that was because when I was self-employed, I'd never made quite enough money to have proper health insurance, but I was making too much to use the government-run health insurance, and I didn't really have proper health care at work until recently, and my health care went from literally non-existent, but there was a plan that I had thought I had signed up for, but it didn't quite work. But that is finally now all sorted out, and I was able to finally make an eye doctor appointment because I had 4-year-old glasses. I did replace my glasses without changing my prescription. My eyes hadn't changed that much at that point, and I couldn't afford to both go to the eye doctor and also get new glasses at the same time because my glasses are super expensive. But again, that's all changed now, and I finally had my first eye doctor appointment last week. I had a follow-up this week, and I have another one next week. So you might be wondering what on earth this has to do with living in a vehicle. And one of the issues that I've had in the past with making doctor's appointments, and especially eye doctor appointments, is actually getting to those appointments and back again. Before I started living in vehicles, I lived in Seattle, and I actually lived in West Seattle, which was kind of in the middle of nowhere. It's a little bit hard to get to compared to the rest of the city, and there really aren't that many doctors in that area. Most of the doctors are in the more densely populated areas of the city, and that made it actually really difficult for me to get to appointments. It could be a very long bus ride, or I could try driving, but then parking would be a major issue, and it never really worked out all that well. Now, because I live in a car, I was able to choose a much more convenient location for me anyways. And so I chose a spot about halfway between Seattle and the Canadian border. It's a town that I regularly drive through, and I've done tons of deliveries there, so I know there's lots of doctors, lots of ophthalmologists, dentists, things like that. And I managed to get an appointment. It was much easier to get an appointment. I only had to wait, I think it was 3 weeks, which for an ophthalmologist in Seattle is pretty short, actually. It takes a long time to get into those clinics. They're booked way out. And I just basically drove up to the city, and I got right in. It wasn't a big deal at all. I should also mention that the cost of this appointment was a lot less because it wasn't in Seattle. Their overhead is probably quite a bit less. The real estate in that area is less expensive than Seattle. I mean, it's still expensive, but less expensive than Seattle. Getting there was as easy as just driving up there. I didn't have to pay for parking. There were no issues with that. The traffic was fine, although it's been snowing off and on for the last couple of days. So that kind of derailed my plans a little bit and caused my eye doctor to be late to work, but that's a completely different story. And honestly, they took their time with me because they could. Their schedule isn't quite as packed as other locations, but it's definitely less densely populated where this clinic is located. And they worked closely with my vision insurance, and it ended up being a really good deal for me because my vision insurance covered most of a new pair of glasses. They also cover contacts, so as you can see, I'm not wearing glasses because I now have contacts, which is going to be interesting living in a car, seeing how this works. I can already tell you my vision is way better with these contacts than it ever has been with glasses. So I'm really liking it so far. I just have to make sure that I can take them in and out properly, and doing that in a vehicle is a little bit tricky, but I'll make it work. The biggest advantage of doing this while living in a car, though, is I have funds to do this. I actually probably could have paid for the eye doctor appointment as well as for a new pair of glasses, maybe contacts as well. I could have probably paid that out of pocket because I don't have the massive expense of an apartment, especially the apartments around here. They're just so expensive. So this has really been a big win for living in a car. I am super excited that I can see properly again. My old glasses were just completely worn out, scratched up, coatings peeling off, and now I have proper glasses, at least they're on order, and I have contacts, which is really the ideal for me in my vision situation, and this simply wouldn't have been possible if I had stayed living in an apartment. So honestly, at least in my situation, healthcare has been much easier to access and use, just both from a financial standpoint and just from being able to get to appointments and actually make appointments in a reasonable amount of time. Unfortunately, I probably will be leaving this job fairly soon, and I'm likely to relocate. And that's going to be a topic for another video, I think. But I just wanted to let people know that just because you live in a vehicle doesn't mean that you can't have healthcare, and you can't get to healthcare easily. I'm sure there are situations where it would be less convenient if you're really sick and you couldn't drive or something like that. Then that could be a problem I could see. But for I think most just generally healthy people or people with medical needs that don't prevent them from driving, living in a car or any other vehicle, it's honestly probably a little bit better just because you have more options, lower costs. And that's it.